sanitizing my hands, doing some hand hygiene. Hi, my name is Miranda. I'm a nurse practitioner student.
My name is Samara John.
Hi, Samara. What brings you in today?
My left ear hurts.
Okay, we will get into your left ear pain here in just a little bit, but I'll do a head-to-toe assessment on you now, okay?
Okay.
All right, can you tell me today's date?
Today is February 13, 2025.
All right, and how did you get here today?
I drove myself here.
Great, and what's your date of birth, Miss Samara?
26 December 1993.
Thank you so much for that information. This patient is alert and oriented. She has good posture and hygiene. Her skin tone looks good and normal for her ethnicity. The patient has good speech as she can talk to me and good cognition as well. So I do not see any acute distress at this moment as well. So we will go ahead and start with your head. And just on inspection, I see that patient has a hairline, a good hairline. It is symmetric. And the patient also had a head full of hair. I will come closer and I will do a palpation on your head, okay?
Okay.
All right. So upon palpation, I do not see any lumps, no lesions. I do not see any swelling. Patient has head full of hair, like I said before, and the head is symmetrical throughout. Patient has no signs of alopecia. The head is full, clean, and nice. There is no lice on the hair as well. I would palpate your temporal arteries, okay?
Okay.
All right, nice pulsation. Could you please move your jaws left and right for me? All right, that is good. Can you open your mouth for me? Amazing. That I'm assessing for TMJ. There is no crepitus while we are here. Could you please smile for me? Frown. Stick out your tongue. Okay, cranial nerve 7 is good. Can you please close your eyes and I will touch on different parts of your face and you tell me where you feel it, okay?
Okay.
We are assessing for your cranial nerve number 5.
Okay.
Where do you feel this?
My jaw.
All right. Which side of your
Right
jaw?
jaw.
All right. Now.
My forehead. My cheek.
All right. Thank you so much. So cranial nerve 5 is good and intact. I'll move down to your neck. Could you please swallow for me? All right. Trachea is midline. I will check for your trapezia. Could you shred your shoulders up for me? Thank you. Good trapezia. I will go ahead and palpate your lymph nodes and I'll start with the pre-auricular, post-auricular, tonsillar, submandibular, submantle, occipital, superficial cervical, posterior cervical, deep cervical, and supraclavicular. I do not feel any lumps. Did you feel any pain or tenderness?
Not at all.
Okay, that's good. Thank you. While we are here, we will move forward into your eyes. Could you please stand up for me?
Okay.
And yeah, stand right here. I'd like you to close one of your eyes and then you read the lowest letters for me. We are doing the reading test.
F E Z O L C R T D.
That's good. Can you do it with the left, the other eye as well?
F E Z O L C F T D.
Thank you. This patient has 20/20 vision. While you are still standing, could you look at the letter E, and look at this pen for me?
Okay.
Patient has good accommodation. Thank you. And you might be seated. Patient has good accommodation. I would like you to look at this. I will look at this pen and follow with your eyes, okay? We are checking for your extraocular eye movement. So can you follow with your eyes? All right, patient has no nystagmus, no lid lag on this patient, and there is no strabismus. I'll go ahead and observe for your corneal light reflex as well as your pupillary light reflexes, okay?
Okay.
All right, can you open your eyes for me? Okay, pupillary light reflex is good. Can you open this one? All right, and can you look forward for me? All right, and corneal light reflex is good as well on both sides of the eyes. All right. Okay, so I will go ahead and inspect your eyes. Just upon inspection, I see that the eyebrows are symmetrical, the epicanthic folds are symmetrical, and they look okay, they look normal. I do not see any discharges or any exudates coming out of the eyes. I will go ahead and palpate your eyebrows here. I don't feel any lumps on palpation, no lesion. I will palpate your lacrimia, puncti, and your lacrimia apparatus. I do not feel any swelling, no lumps. Did you feel any tenderness at all?
No.
Thank you. Can you open your eyes for me? The sclera looks white and normal. The limbo margins are clear. The conjunctiva is pink and moist. The eyes look normal, and that is wonderful. We are going to go ahead and move forward to your nose at this moment. We will start by doing the olfactory nerve test, which is the cranial nerve number 1, which is making you smell this, and let me know what you smell.
Vanilla.
Thank you so much. Patient has a good sense of smell. Now, I want you to close one nostril and take in air with one nose. All right, do the same with the other one. Yeah, close the other one. Thank you, perfect. Now just go ahead with my lights and look at the septum and the nasal mucosa, okay? All right, the septum is intact, there is no deviation, and the nasal mucosa looks good. There is no discharges at this moment, and the nose is perfect. No drainage at this time as well. We will go ahead and look at your ears. Just upon observation, the ears are symmetrical to the outer campus of the eyes. I will go ahead and palpate your tragus and your auricle, okay?
Okay.
All right. There is no swelling, no lumps at this time, and we will do a whisper test here. So, I want you to repeat the words that I will say.
A, B, C.
Thank you. And then you close the other ear. I will do the same for this side. 194.
194.
Thank you. Patient has good hearing. Let's go ahead and move forward to your mouth. Just upon inspection, I see that the lips are pink, moist, and intact. The tongue appears, can you open your mouth for me? The tongue appears pink. It's intact as well as moist. Patient has all of her teeth. Yeah, patient has all of her teeth. The buccal mucosa is pink, moist, and intact as well. The tongue, again, this is my tongue depressor. I would like you to open your mouth for me and say the word ah. All right, that is perfect. Your patient's uvularis is normal, soft, and can we say R again for me? All right, soft and hard palate appears normal and intact. I will push your tongue down and left and right just to test your tongue strength, okay?
Okay.
Thank you. Can you push against this for me? All right, I will push. Tonsils appear normal, and we did test your swallowing when we did the neck check. where I did your trachea check. So we are good with that part. Now we will go ahead and move forward to your chest. I will have you lay here for me. Yeah, can you lay this way for me so that we can move forward to assessing your chest? Thank you so much. On immediate inspection of the thorax, there is no lesions. It is clear. There is no lumps. There is no wounds. Nothing at this moment. The diameter is appropriate, anterior posterior to transverse. Patient has a normal size chest. There is no excursion or any retractions at this moment. She is not taking additional efforts to breathe. She's breathing normally. Could you please take a deep breath for me? Let me feel your normal chest expansion. Great. The chest expands normally. I'll have you sit up for me again as we look through, as I go ahead and inspect your back, listen to some sounds, okay? Thank you. All right, sit right up for me. Okay. And then can you please turn around a little bit so I can inspect your back? Just upon inspection, there is no swelling, there is no lesions. I will palpate down your spine here in just a second, and you will tell me if you feel any tenderness or any pain, okay?
Okay.
All right. All right. Any pain?
No, no
Any
pain.
tenderness?
No, no pain.
All right. Patient has a straight spine. I'm checking the costal angle. There is no pain or tenderness as well. I will go ahead and percuss the costal angle. All right. All right. There is no pain. I will go ahead and percuss the lungs, and I will also check your resonance throughout. Okay.
Okay.
All right. So. Okay. I hear resonance throughout. All right, I will do a quick listen here, and I would like for you to take deep breaths while I do that, okay?
Okay.
All right. Can you take a quick deep breath for me? All right. There is no stridor, no wheezes. All right. At the epiphyseals, I hear vesicular sounds. At the perisinus, there is no wheezing. Do subscapular, there is no adventitious sounds noted. The lateral and the right middle lobe is perfect. And if you just sit properly again, I will assess your lung sounds in the front. Thank you. At the epiphyseal, there is again no stridor. Alright. There is no ronchi. Okay. I don't hear any crackles. I don't hear any squeaks as well. Okay. Patient's lungs appear to be normal at this time. We will go down to the cardiovascular system now. I'll have you lay down again for me. All right, thank you. And using my light, I'll assess the pericardium and the PMI for any, balance, hives, and leaves. There is no balance, there's no hives, there's no leaves, and I will palpate for any balance, hives, or leaves. All right. I will assess your carotid pulses here. Just one moment. All right, the carotid pulses are normal, and they are a +2. And then I will go ahead and palpate the 5 cardinal or cardiac landmarks. Okay.
Okay.
Alrighty. This is the aortic, which is okay. This is the pulmonic, the Erb's point, the mitral, and the tricuspid. And I'll use the bell of my stethoscope to assess for any bruise on the carotid artery. Okay.
Okay.
All right. There is no bruise on the carotid artery. I will assess for murmurs on the 5 cardiac landmarks, and I'll switch over to the diaphragm to assess the heart beat in just a second. Okay, but now let's go ahead and assess for murmurs on all the 5 cardiac heart landmarks. The aortic, no murmurs on the pulmonic, no murmurs on the Erb's point, no murmurs on the vitral and tricuspid. Now I'll switch over to the diaphragm to assess for your heartbeat. Okay.
Okay.
Normal S1 and S2. There is no skipped beats for this patient. I will also assess your peripheral pulses. Okay.
Okay.
So we did the temporal and the carotid pulse already. Now I will do the brachial, the radial pulse, the capillary refill on your legs and arms as well. So let's go ahead and feel for your brachial pulses. All right. Pulse are normal and it's a +2. I will feel for your radial pulses here as well. Pulses are good. It's still a +2 pulse. We'll assess for capillary refill while we are here. Thank you. Okay. Now turn your fingers for me. Okay. Refill is immediate, so patient has good capillary refills. I will go down to your legs and assess for your popliteal pulses and also inspect your legs. Okay.
Okay.
So the popliteal pulses, they are bound. They are +2, so there is good pulsation as well. Patient has just on inspection. There are no lumps. There is no lesion. There is no wounds on the legs, and the capillary refill on the legs is immediate as well, and the tibia pulses as well are good, a +2 on both sides. Now we will go to your abdomen. While you are still laying here, I will take a look at your abdomen. Okay.
Okay.
All right. Upon inspection, there's no balance or hives. Looking at the aortic here, the spine, the skin and abdomen does not have any lesions, no swelling. There is no hernias at this moment. I will auscultate your abdominal aorta with my bell for bruises. Okay.
Okay.
Okay, I do not hear any bruises. There is no bruises here. I will switch to the diaphragm to assess bowel sounds. All right. All right. There is normal active vowel sounds. I will palpate your abdomen. I will palpate your abdomen now. So I will do a light palpation for any lumps, okay?
Okay.
All right, there are no lumps at this time, and I'll do a deeper palpation for any pain right now, okay?
Okay.
All right. Is there any pain?
No.
All right, perfect. The abdomen is good. There is no pain. There is no tenderness. The abdomen is, all the vowel sounds are normal and active. So I'll assess your spleen, which is on your left side. For any splenomegaly, thank you, there's no enlargement. And I'll assess your liver, which is on the right side here. All right, the liver and the spleen all look good. They feel good. They're normal. There's no enlarged liver at this time. I'll have you sit up for me so we could do the range of motions. I will hold to your joints and have you push against resistance, okay?
Okay.
All right, let's start with the neck. Could you, okay, let's start with your head. Can you push against my hand for me? Thank you. Do the same for this side. Do the same for the front, for the back. Okay, good range of motion on the neck. Now I'll have you open and extend your arms for me. Thank you. Can you do arm circles for me, please? All right, there is good range of motion on the shoulders. Thank you. Can you put your hands in front? All right, open them like this and like hold them up like this. All right, can you resist my push? Resist for me. Thank you. And now can you push against my hands? All right, that's good. Everything feels good. Patient, can you please grab my hands? All right. Patient has a good patient has a good squeeze and a strong grip as well. So on inspection of your fingers, upon inspection of patient's fingers, there's no swelling, there's no redness on any of the joints, there's no deformity on any of the joints. I'll go ahead and do the same for your feet, okay?
Okay.
All right, can you do some ankle circles for me? All right, perfect. Can you push against my hands? All right, thank you. Can you pull against my hands? Pull up against my hands. Thank you. All right. Can you lift? All right. I'll have you lay back down so that we can go ahead and assess your hip, okay, for range of motion. All right. I will have you lift one of your legs for me. Alrighty, and this way, okay, just a little. All right, thank you. Can you give me the other one? All right, thank you. And the patient has good range of motion on all parts of the body, on the hips as well. I did some rotation and there was no pain. The knees had no crepitus and no swelling, okay? So now I'll have you sit back up as we go, as we assess your cerebral function, okay?
Okay.
All right, can you sit back up for me? Thank you. You stand up and walk to the letters for me and back. All right, there's good gait and good balance on this patient. Thank you so much. I'll have you do walk on your tiptoes for me as you go towards the letters. Heels, walk for me. Walk on your heels. All right, patient has good balance. That's perfect. Now I'll have you sit down and I will tell you a few words. I want you to memorize those 3 words and repeat them for me later. Rose, salt, and light. All right? All right. Can you put out your right hand for me? We will test your graphesthesia. You will close your eyes. I'll write a letter in your palms and you will tell me what it was, okay?
Okay.
Can you close your eyes for me? What letter was that?
Can you do that again?
Alright. What letter was that?
A.
Alright, good, Gravistasia. We'll test the senses on your lower limbs and arms, okay?
Okay.
Now I will go ahead and touch on different parts of your of your arms and your lower limbs, and you'll tell me where you feel the pain, sharp or dull, okay? I'll do a sharp and a dull pain, and you tell me where you feel it, okay?
Okay.
Alright. Where do you
Sharp.
feel the pain?
A leg.
Is it sharp or dull?
Sharp.
Alright. Where do you feel the pain?
My right leg.
Alright. Is it sharp or dull?
Dull.
Alright. Where do you feel the pain?
My left arm.
Is it sharp or dull?
Is dull.
Alright. What about here?
My right arm. Sharp.
Alright. Perfect. There are good sensations on both upper and lower limbs. Now I will go ahead and test your reflexes. Using this, I will go ahead and hit on your brachial artery and test on your reflexes, okay?
Okay.
Thank you. Good reflexes here. Same here. Can you please, put your legs like that and let me test on reflexes. Alright, everything is perfect. Now then, can you repeat those 3 words I told you earlier?
It's rose, salt, and lime.
Perfect. This patient is great, has passed this assessment with flying colors, and thank you so much for coming in today.